There are people who can drink, but there are definitely people who shouldn't, so I want to make sure to emphasize this point. Coffee is the best. Hello, I'm Dr. Mondeling from YouTube's Great Medical Science. This time, from a doctor's perspective, I'll talk about whether coffee is actually healthy. Is it good or bad for you? And even if it's good, are there really no people who shouldn't drink it? I'd like to explain the benefits and points to be careful about regarding these questions. First, let me emphasize that I'll be introducing a lot of benefits of coffee, and at the end, I'll talk about people who should be careful with coffee, especially women, so please listen until the end. Please make sure to check whether you can actually benefit from coffee before deciding whether to drink it or not. Alright, let's get started. I'm finally going to talk about coffee. I'm a true believer in coffee. I drink about 3 to 4 cups a day. I drink coffee mainly for enjoyment, as a luxury. But in outpatient clinics, patients often ask if coffee is good or bad for health. I work in clinics, hospital wards, and make home visits. I do things like endoscopies, and patients often ask me, "Doctor, is it okay to drink coffee or not?" Or, "I drink coffee, is that all right?" I get these questions a lot. Even hospitalized patients ask about coffee. Some people bring a 1-liter bottle of coffee and drink the whole thing in a day. But for those who need coffee, it's really essential, isn't it? And I think a lot of people feel anxious about whether it's okay to drink coffee. So let's take a closer look at coffee together. On this channel, we share accurate health information in a fun way and provide data to support it. So please make sure to subscribe and hit the like button. The name Mantelling also comes from a type of coffee bean. That's how great coffee is as a drink. So let's talk about the benefits of coffee, shall we? Is this what coffee is like for you? Everyone, I'm going to explain 3 benefits of coffee. Here are the top 3 benefits of coffee. The first one is this, and it's the one I want to explain the most. It lowers the risk of various diseases. We call them illnesses or diseases, but the risk of these conditions goes down. On this channel, I present data from academic papers like this, so the content might get a bit technical. But I'll make sure to provide accurate information, so if you find it difficult, please take notes or listen to it over and over again to help it stick in your mind. When we talk about disease risk, what kinds of diseases are there? The paper I'm introducing this time is actually a systematic review and meta-analysis. I know that might not make much sense, but let me explain what that means. They collect papers according to specific rules. It's not about picking papers that are convenient for them, but gathering them based on those rules. For each paper, they check things like the sample size and whether proper blinding was done, so that people don't know whether they're in the group taking the substance or not. They check whether a placebo was used and things like that. They properly weigh those factors, distinguishing between important papers and those that aren't as significant, and then analyze and present the results accordingly. This time, I'll introduce a paper with the highest level of evidence. It shows some pretty significant risk differences, such as a reduction in the risk of death from any cause. The risk of death from any cause, as well as the risk of diseases caused by blockages in the heart or blood vessels. There is also data showing a reduced risk of heart and blood vessel issues, such as heart attacks and strokes. And cancer. The risk of developing any type of cancer was also reduced. It has also been shown that the risk of developing liver diseases, such as cirrhosis, is lower. Yes, my handwriting is really messy, but it said that the risks of mortality, heart and vascular diseases, cancer, and liver diseases are all reduced. It's surprising, isn't it? In addition, although the data isn't as high quality, there are reports that uric acid, which causes gout, tends to decrease as well. Also, I think many of you are concerned about diabetes, and there is data showing that the risk of diabetes is reduced too. What's even more surprising about diabetes, also called DM, is that this reduced risk applies regardless of whether caffeine is present or not. The risk of diabetes goes down. It's okay even without caffeine. Decaf is fine too. So for those who want to avoid caffeine at night or get headaches from caffeine, there is data showing that the risk of diabetes still goes down even without caffeine. What this means is that it's probably due to polyphenols, which are antioxidant substances that help suppress inflammation in the body, preventing insulin resistance. That might sound complicated, but basically, polyphenols, I'm writing polyph here, but it's polyphenols, by reducing inflammation in the body, are thought to lower the risk of diabetes. This is the main point I wanted to make. Coffee is really amazing, isn't it? It offers many benefits, such as reducing the risk of death, vascular disease, cancer, liver disease, and diabetes, while also lowering uric acid levels. So what are the other 2 benefits of drinking coffee? Just relax and listen here. The second of the top 3 benefits of coffee is this. Yes, it's concentration. I think this one makes sense to everyone. Some people drink coffee and stay up all night before exams, showing caffeine truly boosts concentration, which solid data supports. There's data showing that people who drank coffee scored better in things like calculation and memorization compared to those who didn't. I don't think many people drink coffee just to get smarter, but having coffee when you want to focus really does make sense. I think it's one of the practical methods you can use in your daily life. And here's the third benefit of coffee. I think it has a relaxing effect. Maybe it's one of the best simple pleasures out there. What I mean by this is, surprisingly, coffee doesn't really cost much, right? As long as you buy a pot and a grinder, that's basically all you need. If you just buy some beans and boil some water, you can have coffee right away. So it's great as a hobby too. The aroma is really nice, it helps you relax, and it's also something you can enjoy as a treat. When you want to take a little break and have some coffee, you get these kinds of benefits too. That's why I think coffee is really an amazing drink. And just to be clear, I'm not getting paid by any coffee company. Alright, I really want you to listen carefully from here. I'd like to talk about some important points to keep in mind about coffee. This is pretty important, and even in some well-known videos about coffee by popular YouTubers, there are things they haven't mentioned. I'm going to introduce 3 disadvantages of coffee. The first one is especially important, so please listen carefully. In the second half, I'll be talking about the downsides of coffee. By the way, just as a side note, this coffee here too, right now, I love coffee so much that it's become a routine for me to buy fresh coffee every month and enjoy it. In the second half, there are 3 things you should be careful about when it comes to the disadvantages of coffee, so please make sure to listen until the end. Here's the first of the 3 disadvantages of coffee.
低出生体重児と早産のリスクになってしまう可能性がかなり高いです。これどういうことかというと、先ほどご紹介したシステマティックレビューのメタアナリシスっていう、つまり信頼性の高い論文にも書かれていることになってきます。低出生体重児っていうのは分かると思いますが、ある一定の体重より下の赤ちゃんっていうのは体力が落ちてしまう。
There's a risk of losing your life or becoming more susceptible to all kinds of diseases. So mothers make sure to get proper nutrition so their children don't end up that way. But actually, coffee is said to increase the risk of premature birth for pregnant women. So we can't say that coffee is only good for you without any drawbacks. There are people who can drink coffee, but there are definitely people who shouldn't. So I want to make sure we're all clear on this point. The second of the 3 main disadvantages of coffee is this: people who have illnesses, especially those with circulatory or heart-related diseases. And also, people who are seeing a psychiatrist or a psychosomatic medicine doctor, please keep in mind that those people need to be careful. Now, when I say heart, what do I mean by that? Caffeine can make your heart race. So for people who already have circulatory or heart diseases, it can increase the risk of arrhythmia or make palpitations more likely. Also, some people may experience headaches because their blood flow increases too much at once. So if you have heart disease, make sure to consult your doctor about whether it's okay for you to drink coffee. Alright. And when I say mental health, I don't just mean people with psychiatric conditions, but drinking coffee can affect anyone. I won't go into detail, but with generalized anxiety disorder, you can become anxious about many things, making it overwhelming and hard to think clearly. Anxiety disorder is a condition, and data shows coffee consumption can raise the risk of developing it or similar issues like anxiety. For those with strong symptoms, I think they should avoid drinking too much coffee. The third disadvantage of coffee, this is the third point. Even though I keep saying various things, it's really about the amount. Please be careful about how much you drink. And another thing is individual differences. Coffee contains caffeine, and the way caffeine affects people can really vary. It's said that there are big individual differences. So for people who get headaches, palpitations, or can't sleep after drinking coffee, you need to be careful. Regarding the amount, for coffee, please try to keep it to about 3 to 4 cups a day at most, even if you drink a lot. If you drink more than 400 milligrams of caffeine a day, you might develop a dependency, meaning your body could become one that feels like it needs caffeine. You might start experiencing symptoms like headaches, as I mentioned earlier, or other signs of dependency, so please be careful with the amount of coffee you drink. Do you know how long the half-life of caffeine in coffee is? The half-life refers to the time it takes for the concentration in your blood to drop to half. So what is the half-life of caffeine? Actually, it's a bit long. It's said to be about 6 hours. Caffeine remains in your blood for 6 hours. So if you drink coffee at night, it's still in your system for that long. For example, if you drink it at 6 p.m., its blood concentration will be halved by midnight. So as you can see, even if you drink coffee at 6 p.m. or in the evening, some people may have trouble sleeping at night. So I think the key to staying healthy is to have your coffee by around 3 p.m. or lunchtime at the latest. So, what did you think? This time I explained 3 benefits and 3 drawbacks of coffee. The benefits of coffee are, I explained 3 specific effects, but can you list them one by one? What kinds of diseases does it help reduce the risk of? I went into detail about that. And what I absolutely want you to remember is that there are people who shouldn't drink coffee. The first group is pregnant women. I think pregnant women should avoid drinking coffee. There is a possibility that the risk of low birth weight and premature birth may increase, even if just a little, so I think it's better not to drink it. Also, people with heart disease. And there's also a possibility that it could make anxiety worse. If you consume too much, the risk of substance use disorder can increase. For example, in children with things like energy drinks. Since energy drinks contain quite a lot of caffeine, people who drink 3 or 4 cups a day could become addicted. There's a possibility of that, so please be careful. See you next time.